My fellow healthcare providers, especially personal support worker, if you're assigned to see a client or a resident or a patient for a care, please, these are the things you must do before you go in to see that client. Please, study the care plan. Study the care plan to know a little bit more about the person. And if something is not clear to you, ask questions before you go in to see the person. Secondly, check your provincial or territorial legislation concerning the care that has been listed in the care plan for you to do. Understand what it means. And also check your employer policy, like what are you supposed to do within your organization? Because there are some things that will say you should not do as a personal support worker, and the next on duty will ask you go and do it. Hey, be careful. Make sure you check these things. And another very important thing that you should also think about, your scope of practice. So understand your scope of practice and do things within your scope of practice. Remember, there are things within your scope of practice as a personal support worker, but must be delegated to you by a nurse, and you have to be trained for it for each patient that you're rendering the same care to. Don't forget that. Another most important thing is to hand hygiene. Before you go into a patient environment or a resident environment, please hand hygiene for at least 15 to 20 seconds and put on your gloves before you go in. We'll continue with the rest later, but for now, ciao ciao.